Childbirth is a normal, physiological, and family event. There is a lot of fear during childbirth. And especially now during the pandemic, it's been even more. Today, I'll be sharing with you tips to help you go through pregnancy and birth, especially during this pandemic. Hi, my name is Victoria and I'm a midwife, childbirth educator, and a birth coach. If you're new here, go ahead and hit the subscribe button, turn on the notification bell so you don't miss any of my videos. My first tip is to make decisions based on facts and science and not on feelings and fears. You want to make informed decisions and you don't want your feelings and your fears to make you make a wrong decision. I remember when COVID just started, we had a lot of moms calling us and families calling us that they wanted to birth at home. I am a home birth midwife myself, and so we had a lot of calls. But we saw that a lot of these calls, even though they turned client, but also there were some that really didn't know what it entails to birth at home. So they were basing more their choice on feelings and on fears. So we don't want you to base your birthing options or your decisions on your feelings or your fears. You want to base it on facts and science. So do your research. Tip number 2, you want to take childbirth classes. The more you know, the more confident you'll be to go through birth. I offer childbirth classes. I'll link a description. I'll leave it in my description box below so you can check it out. The more you know, the more confidence you would have to go through pregnancy and childbirth. When you're fearful, fear increases tension and tension increases pain. So when you want to break this cycle. You don't want to be fearful, so it does not increase your tension, and so it does not increase your perception of pain. And so when you take childbirth classes, it will help you to stay informed and also educated, and also it will give you tools to go through childbirth. Tip number 3, have a birth plan or birth preferences. When you have a birth plan, it gives you a framework on which to work to figure out what you want for your birth. So you and your partner can be on the same page. You and your care provider can be on the same page. So it's not like you just go into birth, into labor, and you're not sure what to expect. You've had this discussion, you've talked about it, and you are on the same page. And this does not mean things might go a different way, but when you have a birth plan, you are able to talk about plan A, plan B, plan C, what could happen. And I think birth plans, birth preferences are really, really, really nice to have. Tip number 4, it's a support. You want a support person, whether a birth coach or your husband as a support person, anyone that can be a support to you. There are virtual birth coaches because we have hospital policies or birth centers policies. I think more hospital policies that are not allowing more than one person to be with you in labor. So ask and educate yourself and see if you can have your doula come with you to the hospital, or if you're birthing in the birthing center, or if you're at home, so that you can know what support system to set up for your birth. Right now, like I said, we are offering virtual support. I also offer virtual support anywhere in the world. You could be in Africa or in Asia or here in America, wherever you are, you can get virtual support. So go ahead and check my website that I will leave in the description box below. Virtual support looks like a video call through WhatsApp, through Messenger, through FaceTiming, or any other video platform, so that even when you're birthing, even if we can't be there with you, we can still support you with tips on what positions to be in, tips on how to breathe in and out in labor, and so many other tools to help you birth with confidence and to help you feel that you're not alone and you're made to do this. You're made to birth. Your body is made to birth. Virtual support is better than no support. Another tip is to ask for labor and delivery policy of wherever you're choosing to birth. You want to know what their policies are, especially during this pandemic. Some policies allow support people to be with you, like your husband and your birth coach. Some policies don't allow that. So you want to know what your labor and delivery will look like so that you're prepared for it. My last and final tip is for you to stay home as long as possible, especially if you'll be birthing in the hospital. The more time you spend at home, the less spend in the hospital, and hopefully the less intervention, especially when you are a low risk healthy woman. When you are home, you feel less like you're being watched. You're in your own comfort place. You feel safe. You can eat and rest as much as possible. There are no policies in your home that says don't eat and rest, right? You can also distract yourself. So these are tips for you when you're home, the things you want to do. The first one is to distract yourself as much as possible, especially during the early phase of labor. The second tip is you want to change positions. I like to say every 30 minutes, change a position. I also like to say that whichever position you feel like you feel more intensity, that's probably the position you should be in, because that's what is making your contractions count. It's working well for you. Things to do is to use a birthing ball, a peanut ball. These are things that you can buy on hand to help you with gravity, to help you with optimum position, and to help your pelvis be in just the best position to birth. If you're not sure of what positions that you can try, you can check out my video up here. I'll put a link here so that you can see some of my favorite positions in labor. We have this 5-1-1 rule, which means that when you're having contractions every 5 minutes, lasting at least 40 to 60 seconds, and you've been having this consistently for an hour, this would be a good time to head into the hospital. We call this the active phase of labor. For our first-time moms, we usually will say 3-1-1. So which is when you're having contractions like every 3 minutes, lasting at least 40 to 60 seconds or longer. And this has been consistent for an hour. And so we'll say this will be a good time to head into the hospital. This brings me to the end of the video today. Let me know which of these tips you're planning to use. And also, if you've used any of these tips, let me know which one you really liked. And also, if you have any other tips that has helped you or that you're planning to use, leave it in the comments. You don't know who you'll be helping. And also, if this video has been helpful to you, don't forget to give this video a thumbs up and subscribe if you haven't. And I'll see you in my next video.